The most important point to take away from today is that we need to screen every patient on every antipsychotic for TD and do so regularly. We need to do it both with standardized rating scales like the AIMS or the DISCUS, but also do it with semi-structured examinations in between those structured examinations. Because if we don't look for TD, we're never going to find it. We need to ask the right questions, not just ask, does it bother you? And then if the patient says no, to walk away from it. We need to ask questions about the biological impacts, psychological impacts, and social impacts to really tease out the functional and quality life impairments that TD can cause for many patients who suffer from it. And then once we determine that the patient has TD and that they are having some of these quality of life issues, we need to undertake the correct treatment. There's been a dramatic change in how we look at the treatment of tardive dyskinesia. For over 6 decades, all we really could do was try stopping the antipsychotic or reducing the dose, switching to a lower potency medication, and that just didn't seem to work for patients very well. TD is persistent in almost everyone, unfortunately, and we have to get used to this new paradigm. Previously, we had no proven safe and efficacious treatments. So if we did add on a specific medication, it was often an anticholinergic medication off-label. However, we know that anticholinergics actually worsen tardive dyskinesia and can increase the risk of TD in those who don't already have it. So we need to be much more judicious with the use of anticholinergic medications. And when we do add a medication, the VMAT2 inhibitors are proven safe and efficacious by the FDA, but 6 decades of muscle memory is hard to overcome. So we need to really think about what is the evidence basis behind the treatments that we're making and learn these new treatments for the betterment of our patients' outcomes. I want to thank everyone for joining us in this expert-driven psychiatry case. It's been a real pleasure to go through this data with you, and I hope that you can use it to better the outcomes for your patients.